Hello and welcome everyone to NOAHE Rounds 9, Session 8. I'm Erin Kirwin, Managing Principal at the Institute of Health Economics, and I will be moderating today's session along with my NOAHE co-lead, Dr. Lesley Soril. So in spirit of recognition and gratitude, before we get started today, I would like to take a moment to recognize and acknowledge the traditional territories on which we live and work. The Institute of Health Economics acknowledges that what we call Alberta is the traditional and ancestral territory of Treaty 6, 7, 8 regions, and the Métis settlements and the 6 regions of the Métis Nation of Alberta, whose histories, languages, and cultures continue to influence and enrich our community. So today's session is titled Preparing Health Systems for a Changing Climate, Economic, Clinical, and Climate Health Perspectives. We are joined today by an exceptional panel of 4 experts. So I'm going to begin by introducing each of our panelists. Dr. Sherilee Harper is a professor and Canada Research Chair in Climate Change and Health Equity in the School of Public Health at the University of Alberta. Her research investigates associations between weather, environment, and health equity in the context of climate change, and she collaborates with partners across sectors to prioritize climate-related health actions, planning, interventions, and research. Dr. Harper was a lead author on 2 United Nations Intergovernmental Panel on Climate Change, or IPCC reports, served on the Gender Task Group for the IPCC, was lead author on Health Canada's 2022 Climate Change and Health Assessment, and co-chaired the Government of Canada's Health and Wellbeing Advisory Table for the National Adaptation Strategy. She is currently an IPCC Vice Chair. Ms. Lindsey Komar is a registered nurse and planetary health educator. She currently serves as the Research Director in the College of Health Sciences at the University of Alberta, where she supports the college's research hubs, including the Climate Change and Health Hub. Her work is dedicated to building connections that promote interdisciplinary actions, fostering collaboration across climate networks to break down silos, and support the well-being of both people and the planet. Dr. Bhavini Makwana is a clinical associate professor at the Cummings School of Medicine, University of Calgary, and hospitalist and care of the elderly physician with Alberta Health Services. She is the founder and lead of the Climate Health System Alliance at the O'Brien Institute for Public Health, University of Calgary. Her work focuses on transforming healthcare systems towards low-carbon, climate-resilient models. Dr. Makwana has provided technical advisory support to the Climate Action Advisory Committee, as well as to climate resiliency and emergency disaster management technical committees within the Health Standards Organization and Accreditation Canada. She has co-chaired World Health Organization technical teams on climate and healthcare leadership and collaborates closely with the WHO Health Professional Constituency. She is also co-founder and chair of the Brain Climate Equity Collaborative, and she has global health experience in India, Pakistan, and holds a master's in global health leadership from the Said Business School at the University of Oxford. Dr. Adam Raymakers, PhD, is a health economist and research fellow with Portal, which is the program on regulation, therapeutics, and law at the Harvard Medical School. He is also a member of the Pan-Canadian Oncology Drug Review, or PCODR, the expert review committee with Canada's Drug Agency. He is on the editorial board with the Journal of Cancer Policy and Applied Health Economics and Health Policy. His research interests are oncology, rare diseases, methods of economic evaluation and health technology assessment, and of course, the climate impact of healthcare. So suffice it to say, we are very fortunate to have this exceptional panel of experts with us today. And thank you for joining us. So climate change is increasingly influencing population health, healthcare delivery, health system planning, and resource allocation. As health systems work to adapt to emerging challenges, there is a growing need for collaboration across disciplines to better understand impacts, identify evidence gaps, and inform effective responses. Today's panel brings together expertise from climate and health research, clinical leadership, health system coordination, and health economics to explore these issues from multiple perspectives. So we're going to begin today with brief presentations from each of our panelists. Then I'll hand things off to Lesley to facilitate a panel discussion exploring some of the key issues raised by our panelists and explore emerging opportunities related to climate and health. Finally, we're going to open the floor to all of you for audience questions. Before I pass the mic over to our panel, I'm just going to quickly go over a few housekeeping items. First, all attendees will be muted throughout the webinar. Second, if you want to submit any questions throughout the webinar, which we do encourage you to do, please do so through the Q&A function, and note that this is different from the chat function. Finally, we will raise any and all of your submitted questions during the Q&A period, which will take place in the final 20 minutes of the webinar. So with that, I would like to invite Dr. Sherilee Harper to start things off. So Dr. Harper, the floor is yours.
Wonderful. Thanks so much for having me here today. It's really a pleasure to be able to set the stage for such an interesting group of panelists, and I'm really looking forward to the discussion. So next slide, please. So I'm here today speaking through my role in the United Nations Intergovernmental Panel on Climate Change, or the IPCC. The IPCC is an organization that basically is responsible for assessing the state of climate change science, and it sits under the World Meteorological Organization and the United Nations Environment Program. Next slide. And the IPCC has produced a number of reports. You may have heard some of them before or read some of them, but they have pretty substantial policy impact. And that's because the IPCC really informs a lot of the international negotiations on climate change through the UNFCCC. So IPCC has actually helped prompt the creation of the United Nations Framework Convention on Climate Change, or UNFCCC. It provided the science assessment that underpinned the Kyoto Protocol in 1995. It received the Nobel Peace Prize for its work based on the fourth assessment report. More recently, it underpinned a lot of the discussions and the creation of the Paris Agreement in 2025. And our most recent report that was published, the AR6, Assessment Report 6, published in 2022, and the synthesis report in 2023 informed COP28 global stocktake. So these are pretty high-level international negotiations on climate change, and IPCC basically provides the science. So next slide, please. And what I'd like to do is really just share some of the results from the sixth assessment report to sort of give you a sense of the type of evidence that decision makers at the international scale have at their fingertips to make decisions on climate change. So this is the overarching finding from the report. Basically, the science is very clear. Climate change is a threat to human well-being and the health of the planet, and we really need to take action now. Next slide. And I think that most people can resonate with that. Even if you think about your own experiences with climate change, no matter where you're sitting, maybe it was the heat dome that swept through North America a couple of years ago. Maybe it's wildfire season. If you live on the East Coast, storms and floods are increasing in intensity. The number of heat waves that we're facing, and also the intersection between some of these. I think that climate change is increasingly a real lived experience for most Canadians. Next slide. And we know that has been impacting the lives of billions of people around the world, and that's despite our efforts to adapt. So there's lots of programming that has been developed in response to climate change to try and reduce some of these impacts, and even still, it's impacting the lives of billions of people around the world. Next slide. And so in our report, we also came to the conclusion that climate change has already impacted the health of millions of people around the world. And next slide. And it does this through a number of different ways. So this figure actually is not an IPCC figure. It's an old CDC figure from the United States. And it basically illustrates how climate change impacts every facet and aspect of health, from air pollution to extreme heat to different environmental changes impacting risk of things like vector-borne disease, waterborne disease, food-borne disease, malnutrition, you name it. Climate change can impact that. And Jonathan Patz, who's a physician in the United States, added this pink ring around the outside edge that shows how mental health can be impacted through any one of these changes. Next slide. And in our report, we assessed all the different ways that climate change impacts health. And one of the new things that we assessed for the first time in IPCC history was the impact on mental health. And so what we can assess in these reports basically reflects the evidence that's available at the time. And so in past reports, we had assessed waterborne disease, foodborne disease, vector-borne disease, heat-related morbidity and mortality, air pollution and health, and malnutrition. So we added additional analysis on that, but then also were able to add an analysis of mental health because there was enough literature available on that. Next slide. And so it's not only impacts that we cover in the IPCC reports, but also what we can do about it. And I think that a clear message in the most recent report was that there are things we can do within the health sector to deal with some of these impacts. So we know that heat plans work, early warning systems are incredibly important. Things like mental health services, especially in an emergency context, are very helpful and important. But we also know that a lot of the health gains or health benefits from climate change adaptation actually happen outside of the health sector. So things like improved food security, safe drinking water, access to green space and blue space, all of these things are outside of the health sector, but have huge health benefits within populations and the health sector itself. So next slide. And so what does it say? What does the report say about the costs? So what are the economic costs of some of these things? And I have to say that overall, it doesn't say very much because at the time of the publication of the report, there wasn't a ton of evidence on this topic. So there was some work coming from Australia looking at the massive bushfires that they had in 2019, 2020. They estimated about $1.95 billion in healthcare costs. Next slide. Oh, next slide again. And also some costs related to disasters in Australia, as well as some flooding damages in New Zealand. But those estimates were light on healthcare costs. Next slide. There's also some work done in Southeast Asia and Sub-Saharan Africa looking at the costs of changes in labor, especially related to farming activities, costing billions of dollars as well to global welfare, but not specific to health necessarily. Next slide. We also know that we need to make more investment, that current investment in climate change and health adaptation is not sufficient. Next slide. So basically, in summary, we know that evidence there wasn't a ton of evidence available in 2022 when we published the report. Since then, more evidence has come forth, which we'll hear a bit from other people on the panel. We also know that most of the evidence that was available was really related to disasters and not necessarily climate change related. But we also know that without that information, it makes it really hard to make decisions about climate change adaptation and climate change mitigation, to understand the costs of the impacts, but also the benefits of the responses. So next slide. This is And so this is why it's really important to continue this work. Next slide. And that's why we created the Climate Change and Health Hub, which I'm really delighted that Lindsey is going to tell us a little bit about next. So go to the next slide and I'll pass it over to Lindsey. Thank you.
Thank you, Sherry. And thank you to everyone for inviting me to speak with you today. As Erin mentioned, part of my role as the research director at the U of A College of Health Sciences is to support our college research hubs. So today I'm going to tell you a little bit about the Climate Change and Health Hub and how you can connect with U of A researchers to explore topics in climate change and health economics. Next slide. So the Climate Change and Health Hub is an interdisciplinary group within the College of Health Sciences and involves researchers from across the entire university. The hub brings together faculty, staff, and students united by their passion for climate change and health research. So Sherry and I work together with our members to build a connected network that explores and addresses the complexity of climate health impacts on human health. The hub has a core group of 48 active members and over 25 students. Next slide. We do have a broader network of over 250 researchers across campus that are working in wide-ranging climate change topics, including air quality, green energy, disaster management, and mental health. We've created an interactive online map that was designed to catalog and visualize all these topics and researchers. So this is a really great place to search for an expert in your area of interest. So I will share a link with the map in my slides just on here. So if you look at the bottom, you can click that if the slides are shared after, but I'll also enter it into the chat after my talk. If you have any questions or looking for someone specific, I will also share contact information so you can connect with the hub directly. Next slide. So as we know, climate change acts as a threat multiplier, and proactive action now prevents future health system crises that are going to be vastly more expensive to manage than the cost of prevention. So there's so many climate topics that we could explore together, and I'll just kind of outline a few before we pass to Bhavini. So the World Economic Forum projects about a $1.1 trillion burden on healthcare systems globally by 2050 due to climate impacts. So we are already starting to see this happen in Alberta. And we know Bhavini's going to tell us all about this, but we really hope as a group to support Bhavini to explore the economic benefits of decarbonizing our health system. We're also connected to an Australian researcher named Forbes McGain, who has done extensive work to demonstrate that a low carbon hospital is more efficient, resilient, and cost effective. So we want to work on implementing these well understood evidence-based practices here in Alberta. We also have vast experience in public and global population health, including Dr. Sherilee Harper. And we know that protecting vulnerable populations from climate-related health risks like heat waves, air pollution, and food insecurity stabilizes the workforce and prevents the high economic costs of climate-related morbidity. So there's so many possible projects in this area. We're just excited to get started on them. We're also acting locally by looking at cities as the unit of change. So we have city planners and community engaged researchers working directly with Alberta municipalities to support climate adaptation. Our partnership with the City of Edmonton and the Canadian Association of Physicians for the Environment would love to explore the co-benefits of active transportation. So we know walking and cycling reduce healthcare costs associated with chronic diseases, decrease road maintenance costs, lower personal transportation costs for our citizens, and boost local business traffic. So we have a wide and broad climate network. We're now really excited to connect with economic experts to really make this economic case. Next slide, please. So the take-home message is the Climate Change and Health Hub is the place to connect. So please get in touch with us by checking out our website and emailing us directly at climatehealthhub@ualberta.ca. And now I will pass to Bhavini.
Thank you so much, Lindsey. And I really appreciate being here with these phenomenal panelists as well. So a lot of my work has been really focused around health systems and the impact on health systems. As you've heard, I've been sort of in leadership right across Alberta Health Services. And, you know, my fellow panelists have clearly explained sort of the health impacts. But what is healthcare system seeing? So we know that wildfires and other climate disasters and extreme weather events are actually putting ongoing pressures on our healthcare system that's already struggling with competing healthcare priorities. So, for instance, over the respiratory virus surge that we saw this season, we were also seeing people coming in from extreme cold with frostbite that was already putting pressure on a healthcare system that was reaching capacity that we've never, ever seen before. And then you add that with the other competing priorities, such as workforce burnout, surgical wait times, and climate change is only exacerbating those impacts as well. And we know that climate change is impacting directly our healthcare systems. We're seeing unprecedented evacuations that happened during the floods in 2013, where High River Hospital was flooded, and then we had to evacuate patients from there at South Health campus. We know power grid failures are leading to neonatal services being sort of moved, operating rooms being shut down. So the healthcare system not only is feeling the pressure of increasing patients coming in, but also the actual burden of dealing with evacuations, which is also causing problems with competing priorities. So if when you have OR shutting down, you're now seeing the surgical wait times increase. But healthcare is not innocent in any of this. If we were a country, we would be the 5th largest emitter worldwide. We are higher than the aviation industry, and the Canadian healthcare sector is around 5% of total greenhouse gas emissions in Canada. Next slide. So where do we see a lot of sort of some of this burden come through? And it's really in our healthcare costs. So CIHA has clearly shown that costs for healthcare are increasing, and they're increasing rapidly. And most of those costs are actually coming from acute care. And it's not surprising given the amount of need and demand there is on our healthcare systems. The Canadian Climate Institute projected under a high emission scenario that we were going to see about 270 billion in healthcare costs. So you can now add that to the current healthcare costs that we're seeing. This is only going to continue to increase. Next slide. So how do we sort of move in this direction, and what is some of the work that we've been doing in Alberta? So a group of us actually developed a framework in Alberta to actually embed low carbon resilient healthcare systems. So this is the strategy that we need to execute in order to move clinical operations towards low carbon and more resilient and efficient healthcare systems. And in order to do this, strategies need to be executed within distinct building blocks. So we know we need leadership and governance. We know we need strategies in health system strengthening. We know that we need strategies in health service delivery, as well as looking at quality improvement and education as a framework to drive this work, all centered around our patients as well. What we've shown with this framework and the current strategies that we've done within our current healthcare system is that we are fiscally responsible in terms of moving in this direction, and we've shown operational efficiency as well. So we've already shown that decarbonization efforts lead to cost savings, and then in turn lead to a more resilient healthcare system. And so with that, and we're going to be partnering with the Hub fairly closely as well at the U of A, is we built the Climate Health System Alliance, which we launched last week, a couple of weeks ago, that is really going to look at transforming our healthcare system towards more climate resilient and just healthcare systems. And we're going to do this by showing sort of performance optimization and, of course, the economic framework that we need to be sort of reporting on in order to move our healthcare systems in this direction as well, so that we can be more fiscally responsible and more operational efficient. So with that, I'm going to hand over to Adam.
Thanks, Bhavini. I'll just wait for my slides to load. There we go. Okay, so I'm Raymakers, and as mentioned, I'm a health economist, and a lot of my research is focused on economic evaluation, cost effectiveness analysis, and health technology assessment, and particularly on the methodological side. And so that's sort of the lens or approach that I'll take today. So next slide, please. So to get started, most of you will probably be familiar to some degree with economic evaluation and cost effectiveness analysis, or CEA. So I won't go into detail about the method, but just to say that it's a useful tool in healthcare decision making. So CEA effectively is a way to compare a new health technology or therapy compared to a standard of care, or basically what we're currently doing. Effectively, it's quantifying the costs and benefits between two therapies. Recently, there's been a growing interest in incorporating sort of broader factors like equity and productivity into CEA, and intuitively, it would seem appealing to incorporate climate impact as well. But the problem is that's difficult to do, and we can ask whether it's better to consider sort of cost-effectiveness analysis separately from climate impact of a new health technology. Next slide, please. So even if we choose not to incorporate climate impact into an actual CEA, we can still include it in a health technology assessment, or HTA. So HTA typically considers a number of factors, things like the CEA, clinical value, budget impact, patient perspectives, et cetera. So it's a logical place for climate impact to be included. And health technology assessment agencies around the world are kind of thinking of approaches to incorporate climate impact of healthcare into their processes. In Canada, new guidance from Canada's Drug Agency also acknowledges the role of climate impact in HTA. So I've shown here on the right-hand side the new deliberative framework that CDA expert committees use. And if you notice, there's a box on this right-hand side called distinct social and ethical considerations. And this is where climate impact fits into the process. So expert committees can consider, and I'm quoting here, production, use, or disposal of the health technology. One thing that I think it's also worth pointing out, if you look at this framework more closely, that at least at present, you'll notice the climate impact, and actually along with the economic evidence, which is something people don't often appreciate, this only comes into play after the committee has made their reimbursement versus not reimbursement decision. Next slide, please. So now I just want to provide you with a sort of a quick case study on how we could include climate impact into HTA. So these are two papers from our research group. The first is a real world evidence study, and it compares two triple therapy inhalers. So I'm going to use brand names here because the generic names are a bit of a word soup. So it compares Breztri, which is a metered dose inhaler, and Trelegy, which is a dry powder inhaler. And for our purposes, it's useful to know that the metered dose inhaler, MDI, typically uses a propellant called HFA-134A, whereas DPIs do not use a propellant. So this study showed effectively that Breztri and Trelegy had similar effectiveness and safety profiles. Now, in the GEM study on the right, we estimated the total greenhouse gas emissions associated with all currently marketed inhalers in the United States, and provided estimates of this greenhouse gas emissions on a per inhaler basis. So now with these two pieces of information, we have a foundation for which we can include climate impact into a health technology assessment. So next slide, please. So this is some work in progress, some of which I presented last month. And basically what we've done here is estimate the total greenhouse gas emissions associated with these two triple therapies. That we can, and remember that we consider these to be essentially clinically equivalent. So on the left, I've shown that despite Breztri only making up about 20% of all triple therapy inhalers, it actually has 4 times the greenhouse gas emissions. We can also assign a cost to these greenhouse gas emissions. So the U.S. Environmental Protection Agency estimates what it calls a social cost of carbon, and that essentially tries to assign a dollar value per ton of emissions. And then we can use that when we consider the budget impact of one drug, one inhaler versus the other. And so what I've shown here is essentially an extra $15 million in spending from the use of the MDI, metered dose inhaler, versus the DPI or dry powder inhaler. And I guess that's not a lot when we consider the spending on these drugs is kind of in the billions of dollars in the US, but I still think it's worthwhile to quantify. And I think I'll also say that this analysis, I don't think it's necessarily a perfect approach, but rather just an exercise in working through how to include and consider this information in an HTA, and hopefully it moves the conversation forward in that regard. And that's it for me. I think we're on to questions, and Erin.
Great, thanks so much to our panelists again. Really helped set the stage, and I'm excited for the discussion portion of our session. We're just bringing everybody back online. So at this time, I also want to encourage everyone in the audience to please submit your questions via the Q&A function. They'll start to accrue, and we'll get to them as I start to rack up. But I'm going to kick things off with a few questions. So I'll have a few for our specific panelists, and then open it up for actually any of the panelists to start answering. So let's start with you, Sherilee, just because you kick things off. It was fascinating to hear about this growing body of evidence informing international decision-making. So bringing that lens closer to home and thinking about climate-related health impacts becoming increasingly visible across Canada. So based on your work, what should Canadian decision-makers and jurisdictions be paying the closest attention to as they plan for a changing climate over the next decade or so?
I think maybe two things I'll highlight. The first is more complex climate changes. I think that right now A lot of decision makers are thinking about climate change impacts in terms of like the next heat wave or the next wildfire season. But what happens when these different types of events, compound together or they cascade? Or what if two crises happen at the same time? How do we respond? So, for example, in Alberta, what if we had a heat dome at the same time as we had a really bad wildfire season with evacuations? How do those two events compound each other, and how do they impact the health system and other systems? And I think that right now, a lot of decision makers and even researchers are thinking about like single high impact climate related events or extremes. So the first thing would be the complexity of it. The second thing is the equity dimension. And so I think a lot of what we know about certain climate change impacts or responses comes from a lot of amazing research done through insurance companies and actuaries and that type of science. And I think that's been really important. But what I think there's an opportunity for us to expand on is thinking about equity in those responses. So if we're measuring the success of an evacuation effort by the number of days that people are out of their house or the number of days that it takes for somebody to receive their insurance funds, those are really important metrics to track, but those are only relevant to people who are homeowners or who have house insurance, for example. And so we're also really making sure that we're integrating different metrics and indicators and things to track and monitor and also evaluate from an equity lens, I think is really important too.
That's really interesting. And actually, I have a question then for the entire panel, so anybody can jump in. So given that, the way we talk about climate change and the health issues, it seems as if responsibility for action remains distributed across many sectors then. So who should be leading this work, if anyone? And what might you all perceive as the mechanisms needed to support meaningful coordination across sectors? So health system, government, research, even different levels of communities. Don't all jump in.
I think that we could actually, I think that I could speak to this a little bit. I think the biggest lesson is that we really can't tackle these issues in silos. And so there can't be sort of one leader or anything like that. If you're looking to address a wildfire crisis, like Sherilee was saying, you can't just talk to a lung doctor. You need a forestry expert and an engineer to build air sensors and a disaster planner. And so we really need to kind of be linking these sectors together. And I think that's how we lead, is leading together. So we find the experts in each field and then connect them.
Lesley, I'll jump in, and I agree with Lindsey. I mean, if you look at sort of the healthcare sector and sort of some of the work that we're sort of doing, it's that we're realizing that we do need other sectors involved, right? So if the energy goes out, power grid failure, that impacts our dialysis patients, that impacts our patients on oxygen that have got, medications and refrigerators, right? And it typically is almost equity deserving communities that are affected. And I really think that what really needs to happen is that we have no national strategy. Australia's got a national strategy. They just launched theirs. And what we really need to have is secretariats within sort of the government really sitting there with all these multi-sectorial individuals, from city planners to healthcare, sitting together, working together. It needs to sit at the highest level in order to have that engagement, because I know the hub is working across sectors. We're working across sectors, but it's at the academic level. We really need a secretariat that really is the climate change and health secretariat in the different provinces, leading this work where every single sector is sitting together, including the finance person, right? They need to be right there, because we know that this is going to continue to cost the health system more and more and more. $7.8 million it cost AHS for one of our evacuations. So we really need this kind of group coming together at the highest level.
That's great, and agree completely. And so leveraging off that, what do you think is the barrier then? And maybe I'll start with Bhavini, but obviously open up to everybody, to creating this national strategy and that cohesion across sectors then.
I mean, it's, and this is my whole policy paper that actually Lindsey had, and I appreciate that. It's it very similar to Australia. It's where does healthcare sit, right? And it's really the fragment, like we know that the environment piece sits with federally, and we know healthcare sits provincially, and that is where sort of that fragmentation happens. So it's really hard for sort of to move that strategy because of how fragmented and who has jurisdiction over those domains. And I think, by having a national strategy and looking at what Australia has done, because they have a very similar setup as us, and sort of creating this national group with the provinces and territories coming in, and having a lot of that decision making from the healthcare perspective, and then having federally the environmental piece. But the issue is it's the fragmentation that happens with who has jurisdiction over those areas, I think, is causing the barrier. And of course, there's no finances, no national strategy, and that then percolates all the way down to the provincial healthcare system.
That's a number of barriers to unpack there. But I can see it collectively. Yeah, the inertia is really challenging in that space.
Can I add one thing to that?
Please, Adam.
Just to say that I think one of the things that is another barrier is we don't have great data to sort of let people know, whether or not these problems exist and the extent to which, or the degree to which they exist. And I think until we sort of solve that problem, it's hard to make a pitch to coordinate efforts at a federal level or to get the finance person on board. So I think, particularly as people in the research community, it's something that we could really add to the conversation if we could inform some of these issues with data.
And I just want to,
Go ahead,
add just one thing to what Adam's just said. You're absolutely right. And that's because data is so fragmented. Like, we have a provincial EMR, but there's no access, for to other jurisdictions. So I 100% agree with you. And that was one of the things that was written in that policy paper, was the lack of sort of uniform data across the whole country.
So picking up on that, thinking about those data gaps and maybe insufficient evidence to inform decision making, and how it's challenging to look at across jurisdictions. So maybe to Adam first, what do you see as the most important opportunities to better measure, value, and then eventually disseminate these impacts so they can be meaningful to informing policy and investment decisions then?
Yeah, I think in Canada in particular, we do have good data infrastructure to some degree. I totally agree with Bhavini, like it's not well shared, but I think we have like the underlying foundations of the data, and more of a data friendly community when I compare it to somewhere like the US. And I think if someone, or if a group or some institution maybe took the lead on it and tried to improve that infrastructure and sharing, I think there is a lot of opportunity there. And like I said before, if we don't sort of characterize these issues, and especially as they might become multifactored, and like Sherilee said, like two things happening at once is a lot harder to plan for than one thing happening at once. I think that's like the opportunity is there, and it's like maybe less an opportunity and more a necessity at this point.
So that could be. Oh, go ahead, Sherilee.
Oh, sorry. I was just going to add to this bit of this discussion that on top of that, I feel like one of the number one questions that I get asked by decision makers is, well, like what are the costs and what are the cost savings? We saw this with the National Adaptation Strategy that was released a couple of years ago. That was years in the making, and it was amazing because all of the headlines were about the benefits or how much you save in the long term if you invest in adaptation. And then I think that this also fits into the current like fiscal environment that the provincial governments are in, that the federal governments are in, where it's all about cost savings and how to think about to do this. I feel like there's a really important area of research that's a little bit underdeveloped right now, or could be developed more, because I think that there is a lot of really helpful information out there. But I feel like there's a huge opportunity to deepen that. And given what decision makers are being faced with right now today in this like poly crisis that we find ourselves in, I think that type of costing would be incredibly helpful. And part of that is related to this topic of data and fragmented data across jurisdictions, across different sectors. between academia and practice, and so on and so forth.
I think that ties in quite nicely with the mention of the components or dimensions of the framework that Bhavini mentioned as well. So I'm going to pivot a bit and go over to you, Lindsey. I was thinking, congrats with the Climate Change and Health Hub at the U of A. And it's great you brought over 250 multidisciplinary members to date. What have you learned a bit about what it takes to build meaningful collaborations, which seems to kind of underscore kind of what is needed to facilitate change in this space? And where do you see as the greatest opportunities for the hub moving forward too?
Yeah, I'll tell you, it always seems like it sounds easier than it actually is to build meaningful collaborations where people actually engage with each other and work together across disciplines. One thing that we did is just creating like a space for people to meet and talk about these things. So we started something called Climate Health Action Talks, where we kind of host a panel similar to this, where people can come and engage and find out what everybody else is doing. Because the problem with our campus, it's wide and broad, and there's so many people working in the same area, but they didn't actually get to connect ever. So one thing that we found is we found over 30 researchers working in wildfire, and we've now gathered them together. We're calling them the Wildfire Collective, and then now they're acting as a unit to go after grants and to come up with new ideas. So really kind of creating that space for engagement. And then it's also just building on what you already do. You don't try to start fresh, build on the things that are already happening. Don't reinvent the wheel. So, you don't have to make a whole new degree program from scratch. Students can get together on things like MOOCs. Sherilee just put together an amazing climate health MOOC so that we can start kind of building that knowledge base among our students, and then the students connect and we can kind of start building from there. And I think some of the things that the hub is going to do is really step outside of our academic bubble and start engaging with city planners, hospital administrators like Bhavini, trying to really get the ideas that are coming out of academia put into public policy as soon as possible.
It's great. Thank you. Power in numbers. I really like that. And I also want to congratulate Bhavini on the launch of the Health System Alliance as well. And I feel like I've asked you this several times, but given the health systems face many competing demands for very limited often resources, how do you feel like your work with the Alliance is going to help decision makers approach investment in climate resilience alongside all of these other health system priorities?
Yeah, so I mean, the Climate Health System Alliance was, the goal was really to bridge that evidence policy operations into more that implementation piece of things. Because that's the hardest bit in healthcare systems, is really the implementation piece. And so we've already got case studies on the work that we're actually doing in AHS at that time. Obviously, things have moved about showing sort of the benefits in moving this direction. I mean, if you look at some of the work that we integrated in quality improvement projects, we sort of showed $3 million in cost savings in 3 initiatives that we actually did. And that really didn't require any investment. It just required training, right? And Lesley, this because you were part of some of this in the work that we were doing. And it really just involved training people in a new way of looking at quality improvement. And what I'm hoping the Climate Health System Alliance is going to do is really move from awareness to action. Like, what we're going to do is look at practical tools and frameworks and decision-making support tools that we can develop within the academic space, push it back over to the healthcare system and bring it back, and then evaluate that. And the things that were particularly interesting is performance optimization for healthcare systems and resilient healthcare systems. So for instance, if we look at what is one of the number one biggest challenges we're facing, surgical wait times, right? Well, we know that there are models of care that are low in carbon, but do surgeries side by side, right? And so we can, and they've shown that they can perform a higher number of surgeries compared to our current system that we have. So this is the kind of work that we're looking at, is sort of implementing that and then pulling out the metrics of that and showing that cost savings as well as reducing those competing priorities. as a way to say to government and policymakers that, hey, look, here is the operational efficiency in what we're trying to achieve. And of course, we want to bring that ethics and justice and partnership lens to all of the actual work that we're doing. So, we really want to create a space where we're bringing all these collaborators from a healthcare perspective that actually understand what we're dealing with in the current environment and the lack of sort of funding and resources that we have right now.
It does sound like there's a way forward to dealing with the competing priorities and kind of unearthing that actually they kind of resonate across. So that's really great. Actually, so to Adam, thinking about the decision maker then, and I was thinking about the inhaler example because, as climate considerations are becoming more visible for healthcare decision making, I'm curious to know, how should HTA bodies navigate situations where potentially clinical value, cost effectiveness, and environmental impacts maybe do not align?
Yeah, so the inhalers example is a very convenient example because the two inhalers cost about the same. They work about the same, but one just has substantially more environmental impact. Things will be a lot trickier when we're trading off, the price of a drug versus another drug, or more importantly, probably if the negative environmental impact comes with a better clinical outcome, and that's the sticky situation. I think we'll have to think more critically about what our priority is, and I don't know if we're quite there yet. We're certainly not there in the current framework that we have set up in Canada, because like I said during the presentation, we don't consider, the climate impact or economic evidence in the yes/no decision. It's kind of it's there, but it's a bit of an afterthought. So I think at present we've sort of decided that that's not going to change what we offer in terms of like a drug formula in Canada. Whether there's an appetite to change that, there might be in the future, but certainly that's not the way it's going right now.
Okay, thanks.
Lesley, can I just bring this right back down to the frontline level in healthcare and what we've done and what Adam's saying? We'll give you an example, and the most famous example that goes up nationally is pushing a pain medication instead of putting it in a mini bag, right? So we did a project here at one of our smaller hospitals where we pushed a pain medication instead of putting it in a mini bag. And we basically reported on the triple bottom line. And this is how we're going to have to move forward with embedding this work into policy, into healthcare systems. And what we showed with that project is that not only did we have cost savings of $23,000 a year at one hospital by reducing the mini bag use, we also found the significant carbon reduction and waste, which was important to our frontline who care about planetary health and want to do this work. And if they're seeing the waste reduction, they're motivated to do it. But we also showed the social value. We saved 24 hours in nursing time. And that could be moved from low value to high value care. We didn't have a patient stuck on a pole, sitting there in emergency department. We were able to move them around and they were able to be mobile, which is really important part of your care. So we really need to bring this down to the granular frontline level. And what we've shown with these projects is that staff and healthcare staff care about this, and actually patients do. But we also now need to, as Adam says, start reporting on the fiscal responsibility that speaks to the CFO and the CEO, and then also the social value that speaks to the policymakers that, you're reducing 24 hours in nursing time. This is great. And I think that when we're doing this work, it really needs to be reported as a triple bottom line to show that operational and efficiency and fiscal responsibility.
That's great. Actually, that makes me think of, a lot of it is awareness too. It's getting the message out there, having this shared awareness across different types of groups, and thinking about that, how to try to prepare health systems. It'll require new skills, knowledge, partnerships, as we've all talked about already. So, and maybe this is a loaded question to everybody. What investments in, say, workforce capacity, training, education, or even research infrastructure, which Sherilee mentioned earlier, you think are most needed to strengthen this preparedness?
I'll kick us off by saying all of it. We really need all of it. I mean, This is like, think about all of the municipalities and cities and places that have declared this a climate emergency. And we also know that this climate crisis is a health crisis. And so we really need to be doing all this stuff. Otherwise, we'll be caught unprepared, just like we were during the heat dome when hundreds of people died in just a matter of a couple of days. Deaths that were preventable if we had better preparedness and planning. And I think from the university side, yes, I agree with research. I also agree with like the training comment, and I think training is really essential and a huge in some cases missed opportunity, but other cases, like an opportunity that we need to expand on. And I know at U of A, we have been expanding climate change and health training opportunities, which has been really promising. I think that Alberta, and people will be surprised to hear this, that nationally Alberta definitely has like more training opportunities in climate change and health than other provinces and at the university level anyways. And so I think that it's increasing, but we need to continue that and to expand that. So training is key. You need a prepared workforce, and building that into the curriculum when people are coming through for their university level training is absolutely essential.
Great. It's great to hear that we're leading the charge here in Alberta as well. Anyone else want to jump in there?
I think this is some of the work that we've been trying to do within the healthcare system, and 100% agree with Sherilee here that, it really needs to start from the medical school level. So we know that there is the Associate Faculties for Medicine of Canada roadmap that we've created at the highest level. And there's all this training embedded at undergraduate, postgraduate medical education. But really, we've got staff now that obviously need training. And so, the framework that we developed included a significant amount of training. So, and really, the training needs to be at every single level. And unfortunately, having lived through two crises, it isn't there. And it really needs to involve simulation-based training at the frontline level and then leadership training. So a lot of the work that we've been trying to do is training our leaders to actually think about this, because they're thinking about other operational stuff, but they're not embedding some of this work in. So we need to make sure our leaders are trained, and then we need to do simulation-based training for our frontline staff so they understand how to prepare for this. Because Sherilee's right, we're dealing with a poly crisis, and as part of our launch, we basically hit the city with a flood and a novel virus, and then put the tension of public health as well as evacuations at the same time, to our panelists were part of healthcare, and everything just fell apart. And our workforce cannot handle another disaster. We are exhausted. So we have to get them prepared, but we also have to make sure that they have personal resiliency plans as well. Because during COVID, I was out sleeping in an RV outside my house, right? This is the reality of what healthcare workforce is dealing with right now.
And I'll jump in and add to that. In addition to training the health workforce in terms of like climate health responses and disasters, I think that also embedding this climate change and health training in other sectors and in other disciplines and other programs is also really important, because I think one of the things that I see to be a challenge that we're slowly overcoming is for other sectors to see that health needs to be at the table. When transportation is making infrastructure decisions about climate change resilience, health needs to be at the table. When municipalities are discussing this, even though health is outside of their jurisdiction, they need health people at the table to be talking through these things. And I think you can name any sector when they're talking about climate change response, climate change preparedness, etc. I think that there's a health angle, and we need to have health people at those cross-sectoral tables. Whereas I think before we were too often not invited to those tables. I think that's slowly changing, but I think that another way to like input into that is to offer that training at the undergraduate level in non-health disciplines, so that those other people, so that planners, engineers, everyone can see that the climate change impacts health, and that health is an important partner in the solution.
100%. I love that. And I just want to add that patients are at the center of all of this. And, some of the things that we're looking at, like, our non-for-profit, the Brain Climate Equity Collaborative, is looking at campaigns centered around our patients, checklists, what they need for medications, etc. So 100% agree. And then really centering around that patient as well is going to be important.
That's great. And With that, I wanted to make sure we have time for audience Q&A. I could speak with all of you forever. So Erin, we see a couple questions coming up now through the Q&A function. Did you want to read a couple out?
Absolutely, yeah. So I'll take the first question from Dr. Rebecca Marsh. She says, Thomas Hale describes climate change as a long problem, one with causes and impacts spanning multiple generations. What approaches do you see as most promising for informing policy and investment decisions that are often focused on much shorter time horizons? Adam, we haven't heard from you for a moment. Would you be interested in chiming in?
I mean, that's always a challenge in all sectors, how we can plan for the future and incur the costs today. I think, I mean, communication of what the issues are and, what they will be if we don't act is really important. It also speaks to the education piece so that people understand what these issues are and potential ways to alleviate them. I don't have a good way to bring decision makers necessarily on board right away. But, like I said, my hope is that we'll have the data and information and education to do so sooner rather than later.
Great, thank you. For the sake of time, I'm going to move to the next question rather than going around the panel. This one is from Abdul Hamid, and I cannot see the end of your name due to Teams, my apologies. But in light of recent weakening of international institutions and current geopolitical transitions, how is the IPCC adapting its scientific assessments and communication strategies to maintain pressure on countries/policymakers to meet their CO2 regulation targets? So maybe I'll put this to Sherilee Harper first.
Yeah, gosh, this is that question is like my day-to-day life right now is navigating that. I think it's an important context. I mean, the UN system right now is facing incredible challenges and pressures, and the IPCC is part of that. And so all of the same types of tensions and discussions and geopolitics that you see unfolding everywhere across the UN, we're also seeing that in IPCC. So as one of the working group vice chairs for IPCC, I go to the government panel meetings and I see these discussions and I see these different geopolitics unfold in real time on climate change science. But so there's that piece of it. I mean, that I'm reminded frequently that the IPCC stands for the Intergovernmental Panel on Climate Change. So governments play an important role in that. But at the same time, the actual assessment that's done is done by scientists. And the scientists do that work independently based on the best available science. And so I think at the end of the day, our reports are only becoming increasingly important. And in fact, anytime I feel stress or pressure, or I see the discussions unfolding in the IPCC context with governments, that could be considered discouraging. At the same time, it points to the importance of the work, because if the work wasn't important, then governments wouldn't be investing in the time and space to come in and have these discussions to begin with. So even if some of the discussions can be disheartening from a scientific perspective, the fact that they're happening means that these reports make a difference and that they're important, and we need to keep going. There's lots of things we're trying to do to innovate IPCC, which is hard in a UN context because it's a slow, things are slow to change when you're working in such a huge system. But there's great things that we're doing. So for example, there's a lot of work right now being done on improving the inclusion and engagement with Indigenous knowledge systems in the IPCC. So in the next reports that are going to be published, I think you'll see a lot more inclusion of Indigenous knowledge. A lot more equity focus. We're also engaging with practitioners a lot more, and also practitioners at the municipal level. Up until now, we've mainly engaged with practitioners at the national level and at these international decision-making arenas like the climate change COPs. But the next report that's going to be released is it's a cities report. So it's a special report dedicated to cities, and it has an Alberta connection. The idea of the report was actually launched in Edmonton at IPCC's Cities Conference. There's lots of innovative and promising things happening that give lots of hope, but in a very challenging international geopolitical context for sure.
That's great. I think that's a really very hopeful way to end things and to bring it close to our panel. I just want to say one more thank you, huge thank you to our amazing panel for the engaged discussion, for sharing your stories, your expertise, and your work. We cannot thank you enough. So with that, our session now comes to a close, and actually this marks the end of our series of our NOAA sessions for the year. We will start up again in the fall, and the next seminar is going to be on September 16th with a presentation from Dr. Kidnapa Thaborn. So tune in and wait for the notification to register for that event in the coming months. Please also remember to visit our website, noaa.ca, to register for this, as well as upcoming events such as our Alberta Health Economic Study Group meeting, which will be held October 1 to the 2nd in Calgary. And the theme again will be climate and health. So this was just a bit of a teaser of what could to come for that session. So thank you all again for tuning in. Thanks again to our panelists, and we hope you guys have a great summer.